Hey guys, how you doing? Fred Gonzalez with G&G Productions, doing a different kind of video today. I thought I'd read some entries and definitions and meanings from the Lee County Common Treatment Guidelines, revised in March 2021. It is the most current revision of the county protocols. It's the medical protocols that all the ALS and BLS departments in Lee County use, up to and including Lee County EMS. The reason for this video basically is as a point of reference and to clarify some terms that might not have been black and white, that maybe some people over time lost the definition of, or they thought it was something else when it actually is not what they thought, and just to clarify some other things. The first thing I'm going to start off with, I'm obviously not going to start off from the very beginning. I'm not going to go through the whole thing, just a few things that I thought were kind of important and needed to be addressed. So the first thing is I'm going to give you the definition for an adult, a pediatric patient, an infant patient, and a neonatal patient, the ages that correspond with each. And according to the Lee County protocols, an adult patient is someone over the age of 13 years of age with signs of puberty. A pediatric patient is classified as somebody from age 1 to 13 with signs of puberty. An infant is defined as from 1 month of age to 1 year of age. And a neonate patient is from birth to 1 month. And here's our first pearl, by the way. For the purpose of admission criteria, the Lee Health considers any patient less than 18 years of age a pediatric patient. So if you have a 17-year-old, they say, they're 17 and a half, they're under 18 years of age, they have to be transported to the appropriate receiving facility, which is, the Golisano Children's Hospital. And then your other pearl, for purposes of trauma alert criteria, adult is someone classified of the age 16 and above. So if you have someone that was involved in a traumatic event that's age 16, we're going to assess them and use the adult trauma alert criteria protocol. If they're under 16 years of age, we're going to use the pediatric trauma alert treatment protocol. Okay. So those were some of the ones that I wanted to bring to light and what classifies those certain patients at what age. And the next thing that I wanted to address to you was the definition of a patient. What is a patient? Because I think oftentimes that definition gets skewed and misconstrued, and some people have their definitions of what they think it is when it's actually something else. So a patient shall be defined as an individual who meets one or more of the following criteria. Number 1, any individual with a medical or traumatic complaint. Number 2, any individual with an illness or an injury. Number 3, any individual with a new altered mental status, right? New AMS. Number 4, any individual in the same event as a significantly ill or injured party, e.g. or i.e. motor vehicle crash, structural collapse, explosion, toxic fume environment, etc. So if there is a patient that's in the same vehicle that was involved in a Signal 4 or a motor vehicle accident that has substantial damage, he was the passenger, the driver of that vehicle is hurt, has a lot of injuries, the passenger or the other person in the vehicle is not, we're going to make them a patient because one of the people in that vehicle had a substantial traumatic injury and they were part of that event. And then number 5, any individual who at the discretion of the highest medical authority providing direct patient care, keyword, demonstrates a high index of suspicion or illness or for injury, and that could be at the EMT or paramedic level of judgment. You don't have to be a paramedic to determine if a patient meets the criteria for being a patient. You could be an EMT just as long as they fall under those definition guidelines. And then what I wanted to go over also was refusal of care. There are 3 components to a valid refusal of care. In the absence of any of these components, the refusal can be deemed legally invalid. So this is where we have to pay attention, thus resulting in high liability for the providers, their prospective department, and their respective medical director. So if we mess up, there's a lot of people that can be held legally liable. So we have to make sure that we're letting the people refuse care that are legally allowed to refuse care. So they have to have a competence as defined by Any patient who is an adult age of 18 years or older or legally emancipated, and we'll get further into that in a little bit, is competent to refuse care. A parent or legal guardian, responsible party who refuses care on behalf of their minor child or children, and they have to have decisional capacity as defined by the following. Oriented. All patients undergoing the refusal process must be awake, alert, and oriented times 4. Person, place, purpose, time, or event. Who are you? Where are you? What happened? And why are we here, right? Person, place, purpose, time. And then also their gait, a gait and or coordination. A staggering gait or inability to stand and ambulate may indicate that an impairment exists that alters their decision-making process. So able to walk unassisted. And then continuing on, there's some other caveats on here. Speech patterns, right? Slurred, incoherent, or otherwise inappropriate speech patterns may indicate an impairment that alters decision-making capacity. Insight and judgment, another caveat. Patients must express good insight into the nature of their condition and convey a reasonable plan to deal with their condition. They just can't sign out and just continue to sit on the couch or at the kitchen table, not receive care, and progressively get worse. They have to have an educated plan on what they're going to do with their current condition, right? And then psychiatric decompensation, right? Patients experiencing suicidal or homicidal ideations or gestures have audio or visual hallucinations and or other forms of delusional behavior that alters decision-making capacity. So the signal 20s, the crazies out there, absolutely not able by law to refuse care. They got to go. And then the last one on here is informed refusal as defined by patients must be fully informed about their medical condition, the risks and benefits associated with the proposed treatment, and the risks associated with refusing evaluation, treatment, and or transportation. So you have to let them know, hey, Mr. Johnson, if you do decide to sign out, there exists a real possibility that you could die or perish as a result of not seeking higher medical attention. And when you put it to them that way, they usually decide to go to the hospital. But nevertheless, we do have to explain it to them. Now, emancipation, we spoke about that earlier. There's two types of emancipation. There's legal emancipation, and then there's medical emancipation. And medical emancipation deals with pregnant females under the age of 18. So a medical emancipation is a female less than 18 years of age who is unmarried, pregnant, and or has a minor child, making sense to the medical care relating to their pregnancy only. If we go to the scene of a high school pregnant female, 16-year-old, says she's having shortness of breath and wants to sign out, no. She can't do that because she could only refuse care if it's something related to the pregnancy, not to her health. So relating to the pregnancy and can make medical decisions on behalf of the unborn and born child, right? So if she's with her child, obviously she can make medical decisions on the child. And then legal emancipation is a person less than 18 years of age, but at least 16 years of age who is married, enlisted in the military service, or has been declared emancipated by the court. And here's a pearl for you. In the state of Florida, no minors less than 16 years of age can be emancipated. So you run a call on a 15-year-old, says, he's refusing care, he's an emancipated minor. That's not true. In Florida, you cannot be an emancipated minor less than 16 years of age. So I wanted to bring that to your attention because that's very important, right? And then we get into patients that are able to refuse care. Must be competent, must have decisional capacity, must be informed of the risks associated with refusing evaluation, treatment, and or transportation. Basically the stuff that we had just gone over. Patients who are not able to refuse care. Incompetent, less than 18 years of age, or not legally emancipated. We talked about that. Lacks decisional capacity as defined, and we spoke about that earlier. And then an altered mental status, head injuries, or under the influence of alcohol or drugs. You cannot sign out a person who says they're drunk, they admitted to drinking, and they smell like they have alcohol on their breath. You cannot sign these people out. That is black and white. That is per the protocol. So under the influence of drugs or alcohol, you cannot sign these people out. They're legally not allowed to sign out. And then suicidal ideations or gestures, obviously. Any mental defect, disabilities or deficiencies, mental retardation or developmentally disabled persons, Down syndrome, severe retardation, severe autism. Obviously, those people cannot sign out for themselves. They have to have a legal guardian do that for them because they're not in the correct capacity to sign out. And then severely altered vital signs, right? You have a blood pressure of 60 palp, a pulse of like 30. You know, they're pale, they're sweating, they can barely answer questions. That the only thing they say is, I don't want to go to the hospital, I'm refusing. Well, sorry, Charlie, you got to go. You're not legally able to sign out if you have severely altered vital signs. And then implied consent. A lot of people have difficulty remembering what implied consent is, so I'll go ahead and go over that with you. If a patient is determined to be incompetent and or lacks decisional capacity, they may be evaluated, treated, and transported under the implied consent law. And the implied consent states that what a reasonable individual would consent to under the same circumstances, kind of like the reasonably prudent person thing. Like if you take two people that have the same level of education and service or life experience, that they would do similar things given that situation, right? So that's what implied consent basically states. If the patient is evaluated, treated, and transported on the basis of implied consent, providers should use reasonable measures to ensure safe transport to the closest appropriate facility. Then we get into refusal of care procedures. What do you have to do to legally cover yourself if you find out that these patients are able to sign out? They meet all the requirements. Now, what do you have to do as a provider to make sure that they're being signed out legally correct and nothing comes back on you? And number one, perform a primary survey, history, and physical examination. I cannot stress to you how important it is to do a physical examination. In my 30 years of doing this, I've ran across a couple paramedics that signed patients out, failed to do a physical exam, went back later because they missed a gunshot wound, and now they're doing a cardiac arrest on the patient because they missed that. Stabbings, gunshot wounds. I had one guy one time who changed his t-shirt and had severe evisceration of abdominal organs coming out, but it didn't show outward. So that's why it's so important to do a physical exam before you sign your patients out. I can't stress that enough. Those are all true stories. All right, so perform a physical examination, including a complete vital sign assessment. What is a vital sign? Anything you can put a number value to. Blood pressure, pulse, respirations, SpO2, right? Oxygen saturation, temperature, and glucose. Those things you could put a number value to. Those are all considered vital signs. Make sure you get all those. And then perform primary survey. We did that. So fully inform the patient or reasonable party about his or her medical condition, the risks and benefits associated with the proposed treatment, and the risks associated with refusing evaluation, treatment, and transport. So let them know, again, if you fail to seek further treatment or if you don't want to go to the hospital with an ambulance, you do run the risk of possibly perishing or dying, right? And then sign here and see you later. Have a good day, right? So those are some of the things that I wanted to just point out and just bring to your attention, because over the years, if we haven't gone over some of these things, we tend to skew the meaning of them, and it all seems a little bit garbled until, oh yeah, that's right, that's what it is. And a little factoid, what a PEARL is, right? It's a physical evidence and reasoned logic. So what people would do given those situations, right? So really that's about it, guys. Not a whole lot more that I wanted to go over this stuff with you. I may do one other video, but that's really about it, guys. I hope you can take something away from this, use it as a reference point and something to fall back on. If you don't want to read through the whole protocol, you can just listen to the video or, you know, use it to fall asleep because it's boring, whatever. But that's it, guys. Thanks for watching. Don't forget to like and subscribe button down below. And as always, your comments are welcome. Until next time, Fred Gonzalez with G&G Productions. Thanks for watching. We'll see you on the next one.